This is Dr. Ray Ramirez. Welcome you back to our YouTube channel where we're helping your pets live the best life possible for as long as possible. And we're going to talk today about their teeth. Why it's important to keep their teeth clean and polished, help with get rid of that doggy breath, but also from a medical side, why is that important? Now you may be saying, oh, I just want to get rid of the doggy breath and whatever it is, that's fine. Skip to the end. We're going to talk about some of the medical things because that's the things that excites me. But the most important thing, or I shouldn't say the most important thing, but you want to think of this similar to what we do in people. One of the things we know is that as the tartar and plaque build up on our teeth and gums, gives more of a source of that in our whole bloodstream and can lead to problems with our heart valves and our kidneys. If you know of a friend or family member who has heart disease and before they go into the dentist, they have them be on antibiotics a day or two ahead of time and a couple of days afterwards to make sure none of that bacteria that gets circulated get into the bloodstream and maybe cause problems in their heart. We can see those same type of problems with our pets. So the question is, what do we do and what do we look at? The most important thing to do is to just look. Like I said, what do we look for? We just look. And what we should do is, as you can see my little model here, he's very cooperative. Let me put his dentures back in his mouth here. So what we want to do is just flip the lip. In our next video, we'll have some real live demonstrations so we can show you what we're talking about here. But just flip up the lip. What you're looking for is, are we having any redness in the gums or any tartar where our teeth should be perfectly white? Of course, in this case, you may notice that his teeth are actually upside down, so we'll put them right side up here like this. So it makes it easier. But you can see on this side, they're nice and beautiful and white. The gums are not inflamed. Usually they're opening up. You can see on the bottom here as well, a nice, healthy, light-colored pink. Whereas on this side, which obviously we're seeing here with our model, we can see some redness and inflammation. And what we like to do is grade the tartar on a scale of 1 to 4, 0 being none at all. So this would be a 0. This would probably be a 4. But grade 1 is just a little bit of tartar, but we're not seeing a lot of redness yet. Grade 2 typically has a little bit of a red line in there and a little bit more of the tartar and plaque starting to cover over the teeth. Grade 3, we're seeing that, and maybe we're even seeing some little pus pockets start to develop there. And grade 4, we're seeing a lot more of that. Usually we have to do some extractions because the teeth are just so loose we just can't save them. But what's amazing, we've had a couple of pets where they've been a little bit older. We've done some preliminary blood work to make sure they are healthy to survive to help with the anesthetic. And then their clients have been amazed at how much better the pets feel just 24 hours later getting all that infection out of their mouth. So what we want to do is we want to flip the lip, look at the teeth, get our pets used to that. That's what we're going to start here in this series, is just getting them used to you touching their lip, touching their teeth. Let's get them used to that. And next time, we'll have some real-life audience here talking about how we do that, what it looks like in real pets, and how to get them used to having their teeth and brushed, and having you stick your fingers in there, and what we can do to help prevent this. So again, this is Dr. Ray Ramirez from Lakeview Veterinary Clinic, and if you don't have a regular doctor, we would love to come and see you at Lakeview.